Despite little medical evidence, President Trump has linked Tylenol to autism. Speaking at a press conference on Monday, he suggested that taking acetaminophen, which is the active ingredient in Tylenol during pregnancy, increased the chances of having a child develop autism.
Don't take it. If you're pregnant, don't take Tylenol.
At that press conference, Trump also suggested that vaccines may also cause autism, which is a long-debunked view, and one that's often been expressed over the years by Trump's Secretary of Health and Human Services, Robert F. Kennedy Jr. Consider this. Americans are receiving medical guidance from the president and top health officials that runs counter to mainstream medicine. How are Americans meant to make important decisions about their health in this confusing moment? I'm Juana Summers. This is Consider This from NPR. For more on this, let's bring in NPR food and health correspondent Allison Aubrey. Hi there.
Hi, Juana. Great to be here.
Great to talk with you. I just want to start with a really basic question that I think a lot of people have, and it's this. Is there any proven link between Tylenol and autism?
There is no evidence that Tylenol causes autism. I will say this, that it has been used by millions of people for decades. The American College of Obstetricians and Gynecologists says it is both safe and beneficial during pregnancy. But still, we heard President Trump say that pregnant women should tough it out, that people should not take Tylenol, and that people should fight like hell not to take it. He said there was no downside for people who are pregnant to stop taking Tylenol, which is actually not the truth.
Yeah, those comments caught my ear too. Say more about that. What is the downside?
Sure. Well, high fever during pregnancy can increase the risk of miscarriage, of birth defects, of premature birth, especially early in pregnancy. And this is one of the only medications that is safe for pregnant women to take to treat pain and fever during pregnancy. Almost immediately after President Trump made his comments, we heard from physicians groups and the maker of Tylenol pushing back, saying that there was no evidence to support his claims.
You know, I have to say, just hearing this, it seems that there is this sort of very wide disconnect between President Trump, the Trump administration's policies, and the medical establishment. How did we get here? Help us understand the disconnect.
Sure. Well, let me step back a little bit. You started by asking, is there a link between Tylenol and autism? And I answered by saying there is no evidence that Tylenol causes autism. But let me explain better the word link.
Yeah.
When we talk about a link in science, we're talking about something that scientists call a correlation. Now, there are lots of things that are correlated. I'm going to give you an example. Shark bites and ice cream. What happens during the summer, Juana? What happens to both shark bites and ice cream in the summertime?
Well, I know for me, I eat a lot more ice cream, and I'm imagining there are probably more shark bites, too, because more people are at the beach with their families.
That's exactly right. So ice cream eating goes up and shark bites go up in summer when more people are at the beach. Does one cause the other?
I would say no.
That's right? So that is a correlation. There is a statistical correlation between shark bites and eating ice cream. But does that mean there's causation? Absolutely, positively not. So this gets us back to the body of evidence linking Tylenol and autism. There have been some studies to suggest a small statistical correlation between taking Tylenol in pregnancy and developing autism. But the better studies that try to control for factors such as genetics have shown that that link falls apart. So the basic bottom line here is that the body of evidence suggests that autism is caused by a variety of factors, including genetics and environmental factors, and it is unlikely that taking Tylenol is one of them.
I have to say, listening to the news this week, listening to the president's comments, I found them quite striking. At one point, he talked about a crisis, even a surge in autism, and I think a lot of us are struggling to make sense of this, what to make of those comments at all.
I think that's right, Juana. The president spoke about a 400% increase. And let me just step back and say there is much more awareness of autism than there was 20 years ago, for instance. Right. It is diagnosed earlier. People know what to look for. The interventions to treat it are coming earlier, and milder cases are being diagnosed all the time. So an increase in the identification of cases of autism does not mean a surge.
And we should just note here that what we're seeing from President Trump it's not happening in a vacuum. And when he was speaking, he was standing with his health secretary, Robert F. Kennedy Jr., who for years has had this sort of long, well-documented history of being critical of vaccines. Is there any evidence then to back up the claims that Kennedy and others have made that vaccines cause autism?
There are lots of studies that show that vaccines are safe, and there is no credible evidence linking childhood vaccines to autism. You know, this theory got started decades ago, and the original report claiming that the MMR vaccine, that's the measles, mumps, rubella vaccine, was linked to autism was based on fraudulent data. The doctor that came up with this and actually reported the study lost his license to practice because of this. So somehow this keeps popping up in anti-vaccine circles, but this is not the case. It has been proven to be not true.
So, Allison, as I've been following this, it really seems like there's been a lot of movement, a lot of changing guidance when it comes to vaccines, a lot of changes when it comes to health policy in the Trump administration. Can you just sort of help us understand that?
Sure. Well, you know, it started with the firing of the CDC director. Susan Monarez was fired less than a month after she was confirmed by the Senate because she refused to rubber stamp vaccine policy that wasn't based on science. This is something that Secretary Kennedy has denied. And then there was the big Vaccine Advisory Committee meeting. What happened is all of the members that used to advise the CDC on vaccines were sort of tossed out. Kennedy put in his own members. That meeting was very, very, very tense. The American Academy of Pediatrics actually boycotted it and put out its own guidelines for childhood vaccines.
Allison, help us understand how all of this sort of fits into the bigger picture of health under the Trump administration now.
Sure. I mean, the Make America Healthy Again movement, which was started by RFK Jr., has had a very strong anti-vaccine stance going, way back. When President Trump was elected, he came in saying, I'm going to let RFK Jr. sort of go wild on health was the phrase that he used. And Secretary Kennedy saw his opportunity. So he has come in and he has remade the agency into what he wants it to be. He is very skeptical of mainstream medical evidence and sometimes ignores medical science if it doesn't fit with his own personal views. So all of this tension on Tylenol and autism and the question of, is there a link? It kind of fits neatly into what we're seeing writ large from Secretary Kennedy and the Trump administration.
And during the course of this conversation, we've sort of name-checked and talked about a number of different groups of experts. From your reporting, what are those experts most concerned about right now?
I would say experts are concerned that women who are pregnant are going to be scared to take Tylenol or scared to give it to their young children. I spoke to a pediatrician in Cincinnati, Dr. Nicole Baldwin. She told me a story that when she was pregnant with her daughter, she fell and was in a lot of pain and she needed to take something to relieve that pain. She took Tylenol and she said she just hates to think that people are going to be scared given that this is the one safe medication for women who are pregnant to take for fever and for pain. And I would say, you know what? The bigger picture here is who are we going to trust? People tend to trust their doctors.
Right.
They tend to trust the people closest to them. And when you hear Dr. Nicole Baldwin give this advice, her advice is very much in sync with the American Academy of Pediatrics, right? This is a group of literally tens of thousands of pediatricians who are making recommendations based on A, medical evidence, and B, their own clinical experience. So would you rather take advice from people who have medical degrees and are giving you evidence-backed advice? Or would you like to take advice from someone who doesn't have a medical degree or any clinical experience?
NPR's Allison Aubrey, thanks so much.
Thank you for having me.
And if you want to hear more conversations just like this one, like and subscribe to our channel or subscribe wherever you get your podcasts.